Lynda Lippin again, and this time I want to talk to you about your neck. So hopefully you've seen my video on pelvic stability and on the lower back, and hopefully you've seen my video on shoulder girdle stability and on the rib cage. And once you've kind of addressed the lower and the middle, then you can look at addressing the upper. Most people have some neck tension. Some of it is that our skulls are really heavy. I mean, our heads weigh about 10 pounds and they're sitting on our necks. Now, structurally, our neck is actually built to be one of the most mobile parts of our spine. Part of this is because our eyes are in the fronts of our heads and we need to be able to turn our heads a lot to see what's going on around us in somewhat of a 360-degree sight of view. Now, we also have a lot of movement in the neck going backward, and not as much, but still a fair amount going forwards. A little bit from side to side, although we've got a lot of muscle in between. But as you can see, I mean, the head and the neck should be relatively mobile. What starts to happen, partially because we sit a lot and we work forward a lot and we get very tight in our chest a lot, is that our head starts to literally get pulled down towards our chests. So if you look at me here, you can see I've got some space between my chin and my breastbone. You can see my neck. The minute I start to round that upper body a little bit, as say normal typing posture, you can see that now my neck is drawing down, my chin's drawing down towards my collarbones as my collarbones are lifting up towards my chin, and you start to see less and less of my neck. Okay? So for me, and I'm going to lie down again, the first issue when you're dealing with the neck is dealing with the position of the lower back and the pelvis and the rib cage and the shoulders. So once you get the lower back in the right position, and again here I recommend doing a few just tilting and arching while you're here, finding the middle ground, and potentially doing a few shoulder lifts and maybe 1 or 2 circles to make sure that your shoulder blades are as loose as they're going to be while you're here. The next thing to look at is the neck. The back of the neck should not be flat to the mat. Your neck curves a little bit forward, your lower back curves a little bit forward. And this helps to counteract the fact that your thoracic spine that your ribs are attached to has to curve backward to make room for the ribs. And we need the rib cage there because they protect our heart and our lungs, which are pretty crucial to our continued existence. Now, once you have your spine from the shoulders down pretty much situated into a neutral, you want to look at what's happening with the neck. For most people, we tend to either want to just lift the head forward and look at the ceiling, and I think we all remember the aerobics years when we all taught ab work like this, which literally just pushes the head forward. And I don't know if you can see as I'm doing this, but I'm getting progressively tighter here and here, and it's actually starting to hurt. So that's just a bad idea. The other place we tend to move our necks is we tend to really jam them down and try to open that disc space and drop our chins to our chests. And if I tried to lift my head here, I'd be like this, which if you can see, I'm again pulling my head forward. My neck has disappeared in the front. And again, I've got a whole lot of tension in my neck, and I'm going to shake my head out a little bit because sometimes when I demonstrate the wrong way, it hurts. So what I want to think about here is, first of all, maybe doing a little tilting and arching, tucking and arching, just like I did with my pelvis. So that I drop the chin a little and I arch the chin a little. And I try to just get some movement here at the base of my skull. You can even bring your hands up. You can dig your hands into literally it's a soft spot where you can feel your skull kind of sitting on top of your spine. And just try to move your head from that spot. You can nod, you can do small circles, you can rotate, you can put both hands in there and just kind of feel for that area and where it is, because as your head moves, it starts from there. Once you've done a little bit of that and just have a little bit of sense that you could possibly move your skull right from where it sits on your spine, then we can start to talk about a little more head movement. So now you're going to clasp your fingers and you're going to put your hands under your head. And really let your skull sit in your hands. Let it be the bowling ball that it is. Let your elbows come up just slightly so you're not shoving your shoulder blades back. And letting the head sit in your hands, you're just going to nod your chin a little bit and just start to curl the head up. In this position, there's not a whole lot of craziness going on in the neck. I'm moving my elbows back a little just so you can see my neck, but you can see it's not really tight. As I'm going to come up a little bit higher, you're going to notice that what I'm trying to do is keep my head here and then let my ribs and my spine start to move in response to this flexion. What we commonly do here is, again, most folks are either here with the head up, which hurts, or they've nodded so much that they're pulling their heads forward, which again hurts. So you want to try to find that middle ground of the small lift, the small nod, and then once the head's in place, the rest of the spine takes over. So when I'm in this position, I could actually turn my head if I needed to, because it's relatively loose and free. This becomes important, especially in Pilates mat, because we do a fair number of exercises, such as the hundreds, where your upper body is up for, well, in the hundreds for 100 seconds, which is more than a minute and a half. And it's an exercise in the endurance of being to hold your spine and your shoulder girdle together, keeping the neck relatively free while you're doing the exercise. So again, for the neck, what I suggest doing first is getting the appropriate position of your pelvis in a nice solid neutral, getting the appropriate position of the rib cage and the shoulder girdle. Then working on a little bit of range of motion in the neck, moving at the skull, and then working on nodding and curling the head up a little bit, again using the arms for support to begin with, and allow the flexion to then happen a little more at the spine so that you're pulling the belly muscles in and you start to use a little more of your muscles of your torso to support this weight of your head. That said, it does take neck strength to hold your head up, and we tend to shy away from anything that we even feel in our necks. But neck strength is important. Again, our heads are heavy, and there's a whole lot of muscle in here that when it works well together, helps hold your head up without strain and assists you moving your head. So feeling something in your neck is not necessarily a reason to stop doing an exercise. Feeling pain, feeling shooting pain, that's a reason to stop doing an exercise. But if it feels like your neck muscles are working, I recommend going through that a few times and allowing the neck muscles to work and seeing if it starts to feel better. Again, if you're unsure of your positioning, I think the best thing you can do is find yourself a certified Pilates teacher or exercise teacher who can watch you and help coach you through. Visit me on the web, www.lindalippin.com. And again, this advice is not to replace the clearance and advice of your medical professional, especially if you're having shooting pains or numbness around the neck, shoulders, and arms. You need to see a doctor before you start any exercise program. Thanks a lot and have a great day.